Xylitol and the circle of life. I'm Dr. Ellie, and this video is going to be about how we can use xylitol from the day the first baby tooth erupts in the mouth through every stage of life. Many people question xylitol, how to use it, when's the best time to use it. Really, xylitol, in my mind, is something that we need to think about as a circle. Life is a circle, if we can think of it that way. Xylitol will fit at any point in that circle and change the remaining part of the circle of your life. At 6 months old or thereabouts, usually you start seeing the little baby teeth coming in to the mouth. And they come in, it's called eruption, and these baby teeth poke in through the jaw bone, through the gum, in the front of the mouth. This is the moment to start this child with xylitol. Not mints or gum that you may have heard about, but by using the crystals. And xylitol crystals can be purchased in little packets, are the most convenient, I think, at this stage, because you can take a little packet and empty a tiny amount, kind of a fifth of the packet, just a sprinkle of xylitol. And you can then moisten that with just a drop of warm water. Now, xylitol will not dissolve in cold water, so you need it to be room temperature or slightly warm. They make little tiny brushes for infant teeth. And with this solution of the crystals in the warm water, just moisten the brush, that's simple, and then work it over the new erupting teeth. Now, mums should do this during the daytime when your babies are awake. As more and more of the baby teeth come in, you can continue to use these little brushes right through the first and even part of the second year of their life. It's such an easy way to clean baby teeth. If you find it difficult to work with equipment like that, they do make a little brush that fits on a finger. So you can actually dip this in the solution and then wipe that. Either there's one side that's flat and one side that's like a little tiny toothbrush. And this is a very useful tool if you have a baby and as the baby is growing and wiggling around more. As the child ages and becomes a toddler, now there are more teeth. There'll be molars at the back, and little toothbrushes like this can be used in exactly the same way, moistening the toothbrush with this small amount of xylitol, and when you have the chance, just work it over those back teeth. As a baby ages, they may want to do that for themselves. And you can literally put the toothbrush into the baby's mouth and you'll see they suck on it because they love the taste. It's sweet and delicious. It's going to help those teeth. It's going to feed the good bacteria in the baby's mouth. It's going to promote healthy bacteria that will protect your baby's teeth from plaque, from cavities, from damage. So if you want to breastfeed your baby for years, you can do this if you're keeping the baby's teeth clean with xylitol. You don't need to be fearful. Like a lot of dentists will tell you, as soon as baby teeth come in the mouth, you should stop breastfeeding. I would disagree completely with that. You can breastfeed with great confidence, even at nighttime. You don't have to worry, providing the bacteria in your baby's mouth are healthy. Now, to achieve that, studies have shown us the ideal thing is to clean these teeth with a small amount of xylitol. If you can do it twice a day, that's wonderful. As you get more organized, maybe 3 times a day. When you have a toddler, you can dip the toothbrush and give it to them to suck while they're maybe sitting in a high chair waiting for dinner or waiting for food to come, or after a meal is even better. When you're cleaning up, give the baby this treat of a toothbrush dipped in xylitol. That is the ideal way to train your babies, your toddlers, your young children, that at the end of eating is the ideal time for xylitol. But again, I want to just address nursing mothers. You don't have to wake your baby up in the night to do xylitol treatment after breastfeeding. You've just got the baby to sleep. Don't worry about a thing. Under the age of 5, all those baby teeth can simply be brushed with a xylitol toothpaste or this solution, whichever you prefer. I usually, as the child is able to eat, would add a xylitol mint to the program after brushing teeth at night. Maybe 1 or 2 little mints, such as berry flavored is really good, as you're reading a story. This will again promote good bacteria in the child's mouth as they're sleeping, and that's so important. Don't have fights about trying to floss a toddler's teeth. I'm a mom, I'm a grandma, I have 8 grandkids, perfect teeth, they're not a single cavity with any one of them, and nobody in the family has ever had their teeth flossed as a child. It's all about balancing the microbiome of the mouth, and you can have great confidence if you have small amounts of xylitol throughout the day. Toddlers, after they've been eating a lot of sweet, sticky things, try to end with something like an apple when they start getting to the point where they can eat on a fibrous food like an apple, or some cheese is very protective of teeth. Then maybe a mint right before they go to sleep at night, and those teeth are protected. You don't have to worry. However, the time I want you to start worrying is as the new adult teeth come in. Now we get serious about toothbrushing. Prior to that, it was just having fun. Once the new adult teeth come in the mouth, we really need to be serious. And I would highly recommend using a product that contains sodium fluoride, but not too strong, and you certainly wouldn't use a lot of it. But one of the things we know is that sodium fluoride, in conjunction with the benefits of xylitol, you will get improvements not only in the health of the mouth, but in the health and strength of teeth. And you get more benefits by combining the use of xylitol with sodium fluoride. As I say, not at exactly the same time. We want xylitol at the end of meals, but when you're cleaning your kids' teeth, I highly recommend, once they're 6 years old, because then they have the new permanent teeth coming in at the back of the mouth, you would use a sodium fluoride toothpaste. The other thing you can start introducing at the age of 6 is a rinse, a pattern of rinsing. My kids all began by actually making a rinse, by putting a packet of xylitol into a small amount of water at night, warm water, and then letting the children learn to rinse. Then, if they drink it, there's absolutely no risk. They haven't had anything that is unsafe. It's just a little xylitol in warm water. Then as they get good at rinsing and spitting, you could add, what I did with my kids was add a couple of drops. That was their benefit. They were going to get a little bit of taste to this. Pineapple punch is a popular one, and it's sodium fluoride. This combination is going to help strengthen the adult teeth. No, I don't want them drinking this at this point, but rinsing and spitting out is a learnt behavior that can be learnt around the age of 6, 7. And it will do wonders for these new adult teeth that are coming into the mouth. Now, I want to talk a little bit more about what xylitol has done in preparing the mouth for these new teeth. And I say it that way because as the new teeth come into the mouth, they are colonized by the bacteria that are in the mouth, good or bad. And what dentists know is that the type of bacteria that your teeth were colonized with at the age of 4 are an indication of the future oral health you will have as an adult. So if you've got horrible plaque-forming, cavity-forming bacteria in your mouth at the age of 4, there is an extreme likelihood that you're going to go on having those problems no matter how many fillings, no matter how good your dentist. It is just going to be haunting you for the rest of your life. If we can get children at the age of 4 with perfect teeth, the new adult teeth come into the mouth, and these crevices in the surface of the teeth, the biting crevices, it's the habitat for these healthy bacteria. They will then populate the adult mouth for the rest of life. If you can get a child to have a really healthy microbiome, the bacteria in their mouth, the population in their mouth is healthy, it will transfer into these adult teeth that are forming, and then that will help populate that mouth for the rest of time. And then as your child ages, you're going to go through problems. They're probably not going to want to brush their teeth so much. They're going to go off to college. Who knows who they're going to be kissing, sharing, transferring bacteria with. And all that work you did, is it going to be enough? And the great thing about xylitol use is we believe that there is up to 10 years protection if you have this amazing opportunity to populate the crevices of adult teeth at this age of 5, 6, 7 years old. By the time your kids go to college as teenagers, they will have an enormous amount of protection, whether or not you're there to make sure they brush their teeth or not. It's like a long-term advantage for them. Teenagers can get gum disease, and most of the techniques I teach for brushing are for gum massage. It's not exactly for xylitol, but if you're going to protect your teeth from plaque and from gum disease, you need to have a good toothbrush. You need to have this daily routine of using xylitol at the end of meals. And you can even put, if you get staining or a little bit of plaque on your teeth that's darkening a tooth, add some xylitol right onto your toothpaste and use it. It'll help to exfoliate any little stain parts that you don't like on your teeth. It's a really easy way if your kids are at college and they want to spruce up their teeth without using artificial whitening products. And I want just to mention here that xylitol is very useful if you have any sinus or allergy issues. They do make, this is a company called Xlear, makes a xylitol nasal spray. It's inexpensive. You just mist your nose with this, and it can help keep your sinuses healthy. And your sinus health impacts at the back of your mouth health. I believe that when you have gum disease, oftentimes it is stimulated or it's begun by bad bacteria in one's sinuses. So just remember there's other ways to use xylitol besides simply brushing or having the mints and gum. The other thing to realize with xylitol is that it is really helpful for digestive health. It feeds the bacteria in your digestive tract that form butyrate. Butyrate is actually part of the barrier or functional lining of the digestive tract. I don't personally recommend oral prebiotics, but if you do have or have bought a mouth probiotic, if you look at the ingredients, you'll pretty much always see the first ingredient there is xylitol because it feeds the good bacteria in the mouth. Oftentimes, as people age, they're fighting gum disease. And I have a complete mouth care system that works in conjunction with xylitol. If you already have gum disease, it can help get you to the point where that gum disease is cured. If you have cavities, it can help stop and stabilize those cavities. And this will help terminate the ongoing process of needing never-ending cleanings, never-ending fillings. When you get older and you get to the end of life, it can be difficult to clean teeth. This is where I think xylitol is an incredible help for seniors. And even at the very end of life, we can go back to this idea of taking xylitol, making it into a solution, and then using a sponge. If you have somebody who can't move much and they're lying there in a hospital bed, they're doing chemotherapy, their mouth feels fuzzy and not good, make the little xylitol solution, put it on a sponge, and you can just wipe their mouth over. I did this for my mother at the end of her 50 years of using my complete mouth care system and xylitol. They did a study just recent in 2022. It was an OBGYN doctor from Baylor that gave pregnant women who were at high risk for preterm birth 2 pieces of xylitol gum each day. 1 piece of gum was eaten right after lunch, and the other piece was eaten right before sleeping at night. The results were stunning. It was able to reduce preterm birth in thousands. Thousands of women did this study. And so if you're pregnant, this is something to realize that you can achieve less risk of preterm birth by eating 2 pieces of xylitol gum per day, which is stunning. My ideal recommendation is 5 times a day for an adult. And for babies, start as soon as you see the new teeth erupting in the mouth, and you can enjoy it throughout the rest of your life.